Good afternoon, everyone, and welcome to our very first Focus on Diabetes virtual event. This is clearly marking the close of our month-long recognition of Healthy Vision Month. And before we jump in, I do want to just say that I do hope that everyone, you and your families are staying well and staying healthy during this crazy COVID time we find ourselves in. I am Tracy Brown. I am the Chief Executive Officer of the American Diabetes Association, and I am one of the 34 million people who live with diabetes. I have been living, and I say thriving, with diabetes for the last 16 years. And diabetes and eye health is such a very critical issue. You can't have a conversation about improving the well-being of Americans in this country without talking about diabetes. You can't have a conversation about the impact of cost in this country without having a conversation about diabetes. You can't talk about health inequities in this country without talking about diabetes. And you cannot talk about kind of eye health and blindness in this country without talking about diabetes. Diabetes-related eye disease is the leading cause of blindness and vision complications in this country. This is a very important and critical issue that doesn't get nearly the attention that it should. Because the thing about it is, if you are able to do the things that are required, you don't necessarily have to have blindness and vision complications. And so that's why I'm very excited about the fact that the American Diabetes Association, along with our visionary partners for Focus on Diabetes, are taking this issue head on. To have partners like VSP and Regeneron taking the forefront of this fight with us is just extraordinary. And what is the point of what we're doing? The point of what we're doing is pretty simple. We want to get ahead of this thing and stop the unnecessary complications that come from diabetes as it relates to your eyes. We want to raise the awareness. There are just too many people who don't understand the complication. We want to make sure that we're providing the education and the support that everyone needs around this issue. And then of course we want to continue to be able to educate and help the healthcare providers who are so critical to this equation. I mean, I'm gonna talk about myself. I do get my eye exam every single year. This is, there's no compromising for me on this issue. And when I talk about my healthcare professional team, my eye doctors, ophthalmologists, clinicians, they're a key part of what is important to me actually thriving with diabetes. And so we have just come together today because we wanted to have a conversation about this. We wanted to actually help raise the awareness right now about what is happening and what we're doing. Again, like 1/3 of people with diabetes have complications as it relates to their eyes. 1/3. That's unbelievable. So without further ado, I would love for everyone to help me welcome our visionary partners, VSP Vision Care and Regeneron. I'm so excited and honored to actually share this roundtable with Kate Renwick Espinoza, who is the president of VSP Vision Care. And then of course, Dr. Fuad Amir, who is the medical lead for ophthalmology at Regeneron. And I'm gonna actually kick things over to them and allow them to introduce themselves and get started on this panel.
Great, I can start. Thank you, Tracy. Hi, everyone. I'm Kate Renwick Espinoza, president of VSP Vision Care, the largest not-for-profit vision care company in the US. And we are celebrating our 65th birthday this year. And for 65 years, we've been focused on expanding access to eye care and eyewear. And that's whether it is reinvesting profits back into the communities we serve to bring no-cost care and glasses to those who would otherwise go without, or creating benefit offerings for our Fortune 500 clients and everything in between. We're always focused on expanding and improving care for our nearly 90 million members. So I am very excited to be here today with all of you to help raise awareness about exactly what Tracy was sharing. Raise awareness about diabetes-related eye diseases and how they can be prevented, detected, and managed through annual comprehensive eye exams. Our mission at VSP is to help people see, and I've definitely seen firsthand the impact that vision care can have on people's lives. And I'd love to actually take a minute and share one story with you. So it's a story about Sharon, a patient who we actually profiled with Oprah Magazine last year in O Magazine. And it was a story about Sharon and her eye doctor, Dr. Jarrett Johnson. And Sharon went in for an eye exam, and she had been putting off getting her eye exam. And she went in, and that eye exam resulted in being diagnosed with diabetes. And not just diagnosed with diabetes, but unfortunately, it had gone so long that her kidneys were starting to fail. And obviously, that is a very scary situation and diagnosis. The great news is that that diagnosis allowed her the opportunity to really learn how to manage her health and to be able to change her lifestyle going forward. And she feels really fortunate about that. And I love the fact that she refers to Dr. Jarrett Johnson as her Shiro. Her Shiro, because that Shiro helped change her life and helped her actually make sure she could be healthier on behalf of herself and her entire family. So it's stories like that that keep me so passionate around the work that I do, the work all of us do together to really raise awareness of the value of those annual comprehensive eye exams. So thank you again for having me participate today.
Yeah, thank you, Tracy, for the introduction, and thank you for the area for having this great event and being a partner of it. My name is Fuad Amir. I lead the medical team in the region Iran that are responsible for developing medication to help really manage and treat some of the diseases associated with the diabetic eye disease, like macular edema and diabetic retinopathy. There is also a personal connection for me. I'm trained as an ophthalmologist, but also, if you allow me, I'd like to share a personal story. Early on in my career, as a resident, I was actually in the outpatient clinic. One of my senior faculty called me as I was in the middle of doing work and asked me actually to cover both of my eyes. Initially I was surprised for the request, but anyway, I complied. He was a senior faculty. And then he asked me to go back and work, which was also even more surprising to me. Anyway, a few minutes, which we felt like eternity for me, he asked me to come back and ask me to take the cover off and look at me and said, "Are you frustrated?" Yes, I said. Upset? Yes, I said. Maybe you even want to hit me. I said, "Well, now you ask, probably." I said, "What I just did, Dr. Amir, I made you blind only for 2 minutes. And you see how much anger you had. I wanted you to know that all of your patients that you're seeing either at the fear of losing their sight or already lost some of their sight. And they're angry and upset. So beside really treating these patients and taking care of them, we really need to help them abate that fear. On a personal note, that really shaped really my life as I go and not only look at these patients, but help them. But later on in my career as a researcher in the pharma industry, I take the pride in really leading some of the work that can help these patients. So I'm really honored to be a member here and appreciate the opportunity actually to partner with ADA and the VSP team in order to help increase the awareness about the importance of early screening and regular screening. You know, even sometime if you get diagnosed, you might be seen by eye doctor more than once a year. And that's really the importance because these patients have so many to worry about, you know, beside their eyes, and sometimes the eye may not be noticed because, you know, it's not until it's too late when you really become symptomatic. So thank you again for having me. I'm really looking forward for this engaging discussion and increasing this awareness and helping these patients live a better life and really maintain their sights as long as they can. Thank you.
Thank you. Thank you both for taking the time to speak with us today and sharing those personal stories. I mean, that really, you know, adds the human element to what this is really all about. And so I know for us, the American Diabetes Association, it was so important for us to pick partners that are leading in this space. And so we couldn't be more pleased about that, but we were also very clear around picking partners that really want to drive meaningful impact and meaningful change. And, you know, again, we often talk about the fact that you get 1 point for saying and 9 points for doing. And both of your organizations are really in the doing business. And so we're thrilled. But I would like for each of you to share, and maybe I'll start with you, Kate, just a little bit more about the importance of being a partner for the Focus on Diabetes initiative.
Yeah, absolutely. Thanks, Tracy. VSP is certainly committed to helping people see overall and helping people live healthier lives with diabetes. And we know, and you've spoken about it, I mean, the prevalence of diabetes and pre-diabetes in our country just should not be ignored. There is so much that we need to do to impact that. And neither should this connection to vision, which is why we believe in providing access to comprehensive eye exams for people living with diabetes. And we know that is such an important point of care. And we know that we can always do more to educate our members on this easy but critical step that needs to be taken by simply getting that annual eye exam. And that annual eye exam is important for anyone. We know everybody should get their annual eye exam. But for the more than 100 million Americans who are living with diabetes or pre-diabetes, we know it can play a critical role in preventing or delaying blindness. And two, when it comes to just even finding indicators of chronic conditions, those early indicators that can lead to a diagnosis, people often think of blood tests or they think of screenings through their PCP. And what is often overlooked is the role that the eye exam plays and the fact that it is a non-invasive way to see your blood vessels, which is really unique because there's no place, else on your body that you see your blood vessels directly like you do in the eye. And that provides this great opportunity for that early detection of a variety of chronic diseases. And our data shows that there are many, many VSP members who their eye exam is the first time that these chronic conditions have been detected. And that's key because we know the earlier we can identify chronic conditions for members, the sooner they can begin treatment, the sooner they can put themselves on a path to better health. And that's what we all want. Thank you.
Yeah, thank you, Kate. I echo what Kate just said. It is really essential for us to re-emphasize the importance of eye exam and what does that mean to the patient. And actually, I'm going to cite a recent paper published in JAMA Ophthalmology, where it's a survey conducted actually at the UK, and at least the finding of the survey that the most valued sense among all the senses we have was actually vision. And this is why 88% of the participant of the survey. But also it is the most feared sense that we might lose. So those two factors, beside now we have good effective treatment that can help these patients. The earlier these patients see their eye care professionals, the more likely they get the right help and can really help us in treating a lot of preventable blindness by visiting your eye care, making sure you do that early screening and follow up and then get the right treatment in time. So this is really why we really feel it's a great opportunity to partner with everyone in order to increase that awareness about the importance of early screening, diagnosis, follow up, get the right treatment, because we can do something about it today. Thank you.
Yes, and again, we are beyond grateful to have your partnership and to have you on board for this initiative. I did want to just take a moment. I started this conversation by bringing up COVID-19 and hoping that everyone's family and themselves are staying well and staying safe. But we know this is a stressful time for many, if not all of us. The world has changed. What was normal has changed. We know that as people are navigating COVID-19 and navigating their diabetes, there's fear, there's questions, there's anxiety. And so one of the things that we have done is we've tried to create a resource, and we've created a COVID-19 resource on our website that has lots of information. However, I do have a question for both of you, just as it relates to eye health and navigating COVID-19 right now. What are your points of advice or guidance can you give to people during this time right now? Dr. Amir, I'm going to start with you. Oh, I think you're on mute.
Thank you. During the pandemic, it's really critical to keep your eye exam, because the priority of the eye exam is paramount to go and see your physician regardless. But also it is the continuation of this relationship and the importance of the follow-up that I can re-emphasize again. Early detection and early screening. And I look forward to helping in any other way that we can through educational and communication with our patient, but also the physician actually are available for these appointment to help see this patient. So I can't emphasize the importance of keeping that eye on the top of mind, eye exam that is on the top of mind regardless. And it's something that need to be always there. Thank you. Kate?
I would agree. I would just echo your comments that it's so important right now to keep those lines of communication open between patients and their eye care professionals. In fact, I think a lot of eye doctors are finding ways to enhance that during this difficult time. Many doctors are offering telehealth as an option during the pandemic, which makes eye care just even more accessible. And as I mentioned earlier, that access to care is so important. And unfortunately, people may think that eye care doesn't need to be a priority during the pandemic. But in fact, it absolutely needs to be a priority. I mentioned just everything that's connected to that eye exam and the fact that eyes are a window into chronic condition. So it's more important than ever to make sure your eye doctor is part of your diabetes care team during this time when it may be difficult to get access to other care. In fact, we've heard many stories. I've talked to many VSP doctors and heard stories that they've shared about patients who have been able to connect with them during this time. And if they hadn't received services, it could have unfortunately led to very severe life-threatening impacts. There is one story that was shared with me about a gentleman in Florida who is living with diabetes. He's in his 40s, and he noticed he had blurred vision. He noticed he had redness in his eyes. He didn't go in for an eye exam right away, put it off for a little bit, thought it would go away, and it didn't. So thankfully, he went in to see his eye doctor. He was diagnosed with serious diabetic retinopathy, and he was at risk for becoming blind if he had delayed that care anymore. Thankfully, he didn't, and he was able to go in and see his eye doctor. It's important to note too, during this time, that there's so much being done by eye doctors. I've talked to many of our VSP doctors about the changes that they're putting in place in their practice, putting in safety protocols, changing processes for patient intake, for how they see patients throughout the practice, to make certain that they can keep an environment that is safe for members, patients to come in for care, safe for themselves and their staff to ensure that they can continue to provide that critical care during this time. Thank you.
Yeah, so I'm just gonna, put a pin on what Dr. Amir and Kate has said, and that really is, eye care needs to be a priority. It is a priority during this time, and your eye care professionals is an important part of the equation during this stressful time. Don't delay, right? Like, we all know when things aren't right with our bodies. Don't delay, make it a priority.